this ring over here, right? If I could correct it, that always tells you what? It's a muscle. Which muscle? Very, 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 very hard to determine. There's so many different muscles, different angles and stuff like that. Okay, so it's hard to make that determination. So when you don't know what muscle it is, right, it's always easy to do muscle energy technique, right? So lie down your back. So let's say, we're doing a classic hamstring stretch, right?
Okay, got it.
Right? Right, what do you guys always do, right? You take into what? End range, right? Well, big here, okay? And then what do? Push, right? So push, 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 right? And then relax, 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 relax. And then you go more, right? That's what we're going to be doing to the ribs. The only thing that's complicated is we don't know which muscle it is, right? Like for example, when I'm stretching my hamstrings, which hamstring is the tighter one? Is it the medial side? Is it the lateral side? I don't know, right? So you could, what? You could change the rotation, right? But another way of doing that is when I get to our end range, okay, I say, push into me, right? And don't let me twist you. And that biases one hamstring versus doing the other side. Don't let me twist the other way. Don't let me twist you. Don't let me twist you. Okay, there you go. Okay? By me doing that, what am I doing? I'm getting a different part of the hamstring to contract more to get the relaxation. Make sense? So when I do my corrections, can you sit up, please?
Yep.
Okay. What I'm doing is very simple, right? If it's the right one, I correct it.
So you're doing posterior.
Yeah, pull it, I'm correcting it, right? Relax, sorry. So then, I have to figure out which muscle is going to get this guy to translate the most. Okay? So when you breathe through your belly for me, okay? Do I feel that ring translating? Or breathe through your upper chest? Do I feel that one translating? Breathe through your sides. Does that one get it to translate the most? Because essentially, those three different breaths all require a different muscles to work.
What? Diaphragm.
Alright? Diaphragm.
Scalings.
Yes, using scalings or using accessory muscles. Here, do more intercostals, right? So you're trying to see which muscle, which respiratory muscle is what? Causing the tightness, right? Remember, when a muscle contracts, right? When a muscle contracts, it's going to pull it out of place if it's the tight one. Okay? So, all you have to do is what? Correct it, see which one of those three breaths make it stick out more. Okay? So I'm going to correct it, breathe through your belly. That moves quite a bit. Breathe through your upper chest. That one wants to go up like crazy. And breathe through your side. Oh, breathe through your side. By me putting my hand here, just breathe into my hands. You get that input. A lot of times they just need the feedback.
Yeah, I was just thinking of my ribs like an accordion. Like.
Thank you for the next external focus cue. Great. Okay. So I think upper chest. So breathe through your upper chest, and then I'm just holding on for dear life, not letting that rib translate. Okay. 2 more times. So you do this 3 times. Okay. What do you think we do after 3 times? We can, but we need to what? Really stretch it. So what do I have to do? I rotate it. Right? If it's the right side, rotate right. So I'm gonna rotate her to the right as far as she can go, and then do the 3 breaths again. Breathe in. Okay. So this is called stack and breathe. Whenever you're correcting somebody, you're stacking them in the correct position, and now you're breathing.
It's getting better.
Yep. Okay. Relax. And then we retest, right? If your arm up now. There you go, okay?
Wow, that's pretty impressive.
Yeah, alright. So, we guys are going to do stack and breathe, right? Obviously, if it's single, you just do what? One side posterior rotation. If it's glued, you have to do what? Both sides. Okay? Okay, yeah? HCP for the patient. You do the exact thing themselves. I tell them, put your hand, find the rib. I said, you always hear, how do I know it's the right one? So it's tender, and when you correct it, you get more rotation. So exact thing I teach you is what we teach our patients.
Oh, and I'm lifting it, yeah, up and.
Yep.
Wow, that's crazy.
And then we tell them to breathe in through your sides and through your self-corrections. Alright? Just the same thing, but they're doing it themselves.
That's pretty
Okay? Now relax. Okay? And then for those who feel more adventurous, right? When you are correcting them, right? Ask yourself which muscle feels tight. Okay? And if you think it's a muscle in the front, a muscle in the back, all you have to do is what? Touch that muscle, see if it feels hypertonic. Okay? So when I do this over here,
I think it's
right?
my pecs.
I feel something in the front. Okay? So why is that important? I need to what? Release that muscle. So when I'm doing my stack and breathe, right? Which is over here, right? My other hand's going over here, right? Find that fascicle of the pec, and I'm just releasing it.
Yeah, it's pretty amazing. It
Right?
goes away.
Because why? When I'm doing that muscle, I am what? Lengthening it, right? What am I doing? I'm just going along the longitudinal fibers, and I'm what? Releasing that muscle. Doing a slow, firm pressure, releasing it, moving more forward, moving more forward, moving more forward.
But that makes sense, because if those are tight, then it's pulling it.
Yep, anterior.
Are you doing
Huh?
stimulus pressure or the muscle
He's
strip?
he's taking the length, like he's decreasing the length of my
Yeah.
pec.
If this is a biceps, all I'm doing is this, pushing along here. When you give pressure to a muscle, it inhibits it, right? And by me also going along to fibers, I'm also elongating it. Okay? The most common muscles you have to work on, right? The most common muscles you have to work on is the pec and the external obliques, because they're over here, right? And they'll pull you in anterior rotation. So that's why I'm always palpating the external oblique. Okay? Because what do these two muscles do? They would do what? Pull you into what? Anterior rotation. Okay?
Ah.
And then which muscle? So on the left side, it's going posteriorly rotated, right? So what muscle could cause a posterior rotation on the left side? So-
Sorry, it is.
Yeah, all you guys are right, but the main culprit, much more easier, is the rectus spinal muscles. Does that make sense? Can you turn around?
Yeah, you want me to take this off?
That's okay.
Yeah.
So like imagine so if she shifted this way, right? Right? So that means she's what? She's shifted this way and she's rotated this way? Right? Yeah? Alright, lean backwards. Yeah, no, this back, right? Shifted right, yeah, rotate to the left, right? That means she's doing this, right? And then this is this, right? So this guy is what? Posterior rotating. So what muscle attaches the ribs that will posterior rotate you? The rectus spinal muscles. Right? The longissimus, the ilicostalis, right? Does it make sense? So when we get to lower back class, when we see somebody with tight hypertonic muscles to the lower back, I'm going to tell you, trace it up to the ribs. They call these muscles over here spotlights, right? To the ring that's in dysfunction. So the muscle will stop getting tight at the level of dysfunction, right? Some people call them idiot spotlights. Say, hey, there you go, that's one. Okay? I know, that's what I say, but it's that way. So what am I telling you? All right. Remember, when in doubt, when you forget all this biomechanics, this is the main lesson of today, right? If it's shifted this way, I'm doing what? Posteriorly rotating, right? Then what do I do to fix it? Breathe. See which one of those helps, right? And then, if you want to release the muscle, it's either a tight muscle in the front here on the right side, or a tight muscle in the rectus spinal on the left side. And you pop it, and you release it. Okay. Yep.
When you asking for breathing, you feeling how much
It translates out. Which one of those three breaths
pulls it out the most?
pulls out the most?
Okay.
Okay. So it's a pretty simple technique. Is this doing muscle energy? Yep.
you hold the correction while they breathe, or you wait?
Yes, you hold it for dear life,
Okay.
right? Because what's happened, that tight muscle or fascia, whatever, is trying to cause a displace, right? So no, you're gonna stay there, and that's gonna force the stretch. Okay?
And then that's how you train them, like after your
Oh, that's next part.
newfound. Oh,
We're
okay.
gonna talk about retraining next.